Dr. Shoshana Ungerleider joins us now. She is an internal medicine physician and host of the podcast TED Health. Dr. Ungerleider, thanks very much for being with us. So Jill Biden did test positive for COVID-19, as we've been saying, just as she was set to begin teaching courses at a community college in Virginia this week. This is not her first battle with the virus. Is there any way to know if this new round will be less severe?
Well, Elaine, I'm so glad to hear that so far it sounds like her symptoms are mild. I suspect she's taking Paxlovid, the COVID antiviral medicine, to lower her risk of getting seriously ill, which is important. I'm certainly keeping the First Lady in my thoughts for a quick and an easy recovery. Her situation serves as a reminder to all of us that we may feel like we're done with COVID, but it isn't done with us.
Well, COVID-19 hospitalizations are rising as the new EG5 variant grows in dominance across the country. How concerned should parents be as their children head back to school?
Well, Elaine, we thankfully aren't where we were in January of 2022 with cases and hospitalizations and deaths. But I think this overall, this increase isn't good news as kiddos are heading back to the classroom and we're all going to be spending more time indoors as the weather cools off. The dominant EG5 has genetic changes giving it an advantage, but it looks like its contagiousness and severity are unchanged. And the good news is that existing tests and treatments are effective. In the coming weeks, a new vaccine is going to be available, which was designed based on a variant genetically similar to EG5. So we do expect it to provide protection against this variant. Now, there's another new variant, BA2.86, which is not yet widespread, but it is causing some alarm because of its really numerous mutations, which represents a pretty significant evolutionary jump. But we're going to have to wait and see what this means for transmissibility, the severity of illness, and then vaccine protection.
So in addition to COVID, health experts also warn of the spread of other respiratory viruses this fall, including the flu and RSV. Doctor, how do the symptoms of these diseases compare to those of COVID-19?
Elaine, it's tricky. So many of the symptoms do overlap, like sore throat, runny nose, cough, fatigue, headache, body aches. Typically the COVID-19 symptoms of loss of taste and smell, and in some cases, diarrhea, don't usually happen with RSV and the flu, but they can. So remember, the best thing to do if you feel sick is to stay home if you can, wear a well-fitting N95 or KN95 if you need to be around others, especially people who are high risk for severe disease, and use those at-home tests for COVID so you know what you're dealing with.
And what should everyone who's returning to classes in the coming days do to best protect themselves from getting sick?
Well, I can tell you, for me, I've been fortunate to not get COVID, although I never know what tomorrow might bring. So as a doctor, I don't mind wearing an N95 mask inside, but I realize it's not that way for others. I think it's about knowing your own risk tolerance, being extra cautious in high risk places. So I've tried my best to prioritize safety for myself and for my family and my patients. The basic steps that we can all take this fall and winter: wear an N95 or KN95 in crowded or high risk places like airports, theaters, public transportation, maybe for some people in the classroom, anywhere there isn't good airflow, given the transmissibility of newer variants. Those cloth and paper masks really don't do much. Stay up to date with vaccines for flu. Now we have RSV vaccines if you're 60 and over, if you're pregnant, if you're immunocompromised, and if for infants as well. And then, of course, those COVID-19 boosters. Keep up with washing those hands with soap and water or hand sanitizer with at least 60% alcohol. And of course, if you're feeling sick, it's really best to stay home if at all possible. And indoors, proper ventilation actually makes a huge difference. So open those windows when you can and use air purifiers if you have them.
All right, Dr. Shoshana Ungerleider. Doctor, thank you so much.
Thanks for having me.